Myeloproliferative neoplasms, MPNs, are a group of blood cancers that occur when the bone marrow cells that produce blood cells develop and function abnormally. The abnormal cells, which would normally develop into healthy blood cells, grow uncontrollably, resulting in an excess of mature or immature blood cells in the peripheral blood. There are several types of MPNs, including chronic myelogenous leukemia, CML, polycythemia vera, PV, essential thrombocythemia, ET, and primary myelofibrosis, PMF. Each type has distinct features but shares common characteristics, such as the overproduction of one or more types of blood cells. In CML, there is an overproduction of white blood cells, whereas PV is characterized by an excessive production of red blood cells. ET involves an overproduction of platelets, and PMF is marked by scarring in the bone marrow which disrupts normal blood cell production. The exact cause of MPNs is not entirely understood, but several genetic mutations have been identified in patients with these conditions. For instance, mutations in the JAK2 gene are found in the majority of patients with PV and a significant number of patients with ET and PMF. Other mutations, such as those in the CALR and MPL genes, are also observed in MPNs and play a role in the pathogenesis of these diseases. Symptoms of MPNs can vary widely depending on the type and severity of the disease. Common symptoms often include fatigue, headaches, dizziness, night sweats, and an increased risk of bleeding or clotting. Some patients may also experience splenomegaly, which is an enlargement of the spleen due to the excessive breakdown of blood cells. The diagnosis of MPNs typically involves a combination of blood tests, bone marrow examinations, and genetic testing to identify specific mutations. Treatment options for MPNs depend on the type and severity of the disease. They may include medication to reduce the production of excess blood cells, targeted therapy to inhibit specific genetic mutations, and in some cases, stem cell transplantation. Hydroxyurea is a common medication used to manage PV and ET, while tyrosine kinase inhibitors like imatinib are used to treat CML. Patients with PMF might be treated with JAK inhibitors such as ruxolitinib. In addition to medical treatment, regular monitoring and supportive care are essential for managing symptoms and preventing complications. This may involve routine blood tests, periodic bone marrow assessments, and strategies to mitigate the risk of bleeding or thrombotic episodes. Living with an MPN can be challenging, but advances in research and treatment are continually improving the prognosis for many patients. With ongoing medical care and support, individuals with MPNs can manage their condition and maintain a good quality of life.